Here we are going to see the morphology, cultural characteristics, biochemical test, pathogenicity, laboratory diagnosis, and the prevention of staphylococcal diseases. Staphylococci are gram-positive cocci that occur in grape-like clusters. In Greek, staphyl means bunch of grapes and coccus means berry. These organisms are very ubiquitous and form the most common cause of localized suppurative lesions in human beings. Suppuration means formation of pus. Here you can see the some image of a staphylococci. Let's see the classification of Staphylococcus. Firstly, based on a chemical test known as coagulase test. An example of coagulase positive organism is Staphylococcus aureus, and negative organism is Staphylococcus epidermidis and Staphylococcus saprophyticus. The next classification is based on pathogenicity. Staphylococcus aureus is a common pathogen, and there are also some opportunistic pathogen in the Staphylococcus genus that includes Staphylococcus epidermidis and Staphylococcus saprophyticus. And there is also a non-pathogen in the Staphylococcus group, and the example of that is Staphylococcus hominis. Let's see the morphology of Staphylococcus aureus. These are spherical cocci and approximately 1 micrometer in diameter, and they are arranged in grape-like clusters. Usually Staphylococcus aureus are non-motile and non-spory. Coming to the cultural characteristics of Staphylococcus aureus, they grow readily in ordinary media with a temperature range of 10 to 42 degrees Celsius, and the optimum temperature is usually 37 degrees Celsius and pH is 7.4 to 7.6. On nutrient agar, after incubation for 24 hours, the colonies are large, circular, convex, smooth, shiny, opaque and easily emulsifiable. Most of the strains will produce a golden yellow pigment in nutrient agar. The colonies on blood agar are similar to those on nutrient agar, and most of the strains are hemolytic, especially in the presence of carbon dioxide. The hemolysis is usually marked on rabbit or sheep blood. The next one is McConkey agar. They produce smaller colonies that are pink due to lactose fermentation in McConkey agar. There are also certain selective media devised for isolating Staphylococcus aureus, and these include media such as salt milk agar, Ludlam's medium. The salt milk agar consists of 8 to 10% NaCl, and the Ludlam's medium consists of lithium chloride and tellurite. In nutrient agar, you can see the large circular, convex, smooth, shiny, opaque and easily emulsifiable colonies here, and also the strains produce a golden yellow pigment on nutrient agar. On McConkey agar, the colonies are small and pink in color. On blood agar, as mentioned earlier, most of the strains will be showing beta hemolytic colonies. In beta hemolytic colonies, it shows clear colorless zone of hemolysis within which the red cells are completely lysed. Coming to the biochemical reactions, the catalyst test is positive for Staphylococcus aureus. When a loopful of hydrogen peroxide is placed along with a loop of Staphylococcus aureus colony, effervescence will be produced, as you can see here, and this indicates the production of catalase, and this test is positive for Staphylococcus aureus. Coagulase test is done by two methods, the tube and the slide coagulase test. The slide test detects bound coagulase, and it is much simpler than the tube test. For the slide test, the isolate is emulsified. The isolate is the culture. is emulsified in a drop of saline on a slide, and to this a drop of human or rabbit plasma is added and mixed well. And if a clumping is seen, and this will be indicating of the positive test. Whereas in tube coagulase test, it detects free coagulase. About 0.1 ml of young growth culture of the organism is added to 0.5 ml of human or rabbit plasma in a narrow test tube. Oxalate or heparin may be used as an anticoagulant for preparing the plasma. Then the tubes are incubated in a water bath at 37 degrees Celsius for 3 to 6 hours. If it is positive, the plasma floats and does not flow when the tube is tilted. So in this test you can see that Staphylococcus aureus gives positive for both the slide and the tube coagulase test, whereas Staphylococcus epidermidis doesn't give positive result for both these tests. And both the slide and tube coagulase test is used to differentiate members within the Staphylococci, and it detects the clumping factor that is found in Staphylococcus aureus. So if the agglutination is found, the test is considered to be positive, and if there is no agglutination means it is negative. And in the tube coagulase test, as mentioned earlier, it detects free coagulase, and here the positive test is shown by a clot formation. Besides the catalase and the coagulase test, other biochemical reactions that predict the Staphylococcus aureus presence are that it reduces nitrate to nitrite, it ferments mannitol anaerobically with acid only, and it is positive for both urea hydrolysis test and gelatin liquefaction test. It has the ability to produce lipase, phosphatase, and thermostable nuclease. Coming to the resistance of Staphylococcus, they can withstand 60 degrees Celsius for 30 minutes, and some Staphylococci require 80 degrees Celsius for 1 hour to be killed. Heat-resistant strains have the ability to grow at a higher temperature, even at 45 degrees Celsius. They can resist 1% phenol for 15 minutes. The fatty acids inhibits the growth of Staphylococci. The highly unsaturated acids have a more powerful action on coagulase positive than on coagulase negative strains. Staphylococci are generally sensitive to lysostaffin. Lysostaffin is a mixture of enzymes produced by a particular strain of Staphylococcus epidermidis. And Staphylococci are uniformly sensitive to penicillin and resistant to erythromycin, tetracycline, and aminoglycosides. Pathogenicity. Pathogenicity of an organism refers to the property of that particular organism for causing diseases. Staphylococci produces two types of diseases. First one is infections. In infections, the cocci gain access to damaged skin, tissue sites, and they colonize there, adhering to cells and the extracellular matrix. Sitting there, they multiply and cause tissue damage. The sources of infections are exogenous, that include patients or carriers, and endogenous, that is from colonized site. Mode of transmission of infections include direct contact and through indirect contact, that is through fomites, that include door handles, handkerchief, pen, pencil, and the second method is through the inhalation of airborne droplets. The second type of staphylococcal disease is that the intoxications. Here the disease is caused by the bacterial toxins that is produced either in the infected host or which is preformed in vitro. Virulence is a pathogen's or microbe's ability to infect or damage a host. There are several virulence factors in Staphylococcus aureus, and mainly they are divided into cell-associated factors and extracellular factors. The first one is cell-associated factors, that includes cell-associated polymers and cell surface proteins. The cell-associated polymers include cell wall polysaccharide peptidoglycan that confers rigidity and structural integrity to the bacterial cell. And the second one is teichoic acid. It's an antigenic component of the cell wall and it facilitates adhesion of the cocci to the host cell and protects them from complement-mediated opsonization. And the third one is capsular polysaccharide surrounding the cell wall. It also inhibits opsonization. Opsonization is the process by which bacteria are altered by opsonins so as to become more readily and more efficiently engulfed by phagocytes. Next one is the cell surface proteins. In the first one is the protein A, and it has many biological properties including chemotactic, antiphagocytic and anti-complementary effects. It also induces platelet damage. Next one is a clumping factor. The clumping factor is otherwise known as the bound coagulase, and this factor is responsible for the slide coagulase test which we discussed earlier. And in this image you can see the cell-associated polymers and cell surface proteins that is contributing towards the virulence of Staphylococcus aureus. The next one is the extracellular factors. It includes enzymes and toxins. In that, the first enzyme is free coagulase. It is an enzyme which brings about the clotting of human or rabbit plasma, and it is responsible for the tube coagulase test. It acts along with a coagulase reacting factor, that is CRF, present in plasma, binding to prothrombin and converting fibrinogen to fibrin. Coagulase test is the standard criteria for the identification of Staphylococcus aureus isolates. And the second one is the catalase enzyme, and that is responsible for the positive test of catalase in the case of Staphylococcus aureus. The next enzyme is the lipase. It produces a number of lipid hydrolysis which help them in infecting the skin and subcutaneous tissues. Then hyaluronidase, which breaks down the connective tissues and help in the initiation and spread of infection. Then the DNase, it's a heat stable nuclease. Then there are protein receptors, staphylokinase, phosphatase. So these are the enzymes that is included in the virulence factor of Staphylococcus aureus. Now let's see about the toxins. The first one is the cytolytic toxins, that is damaging the cells. And cytolytic toxins are membrane active substances that consist of 4 hemolysins and leucosidin. The 4 hemolysins include alpha, beta, gamma and delta hemolysins. In that, the alpha hemolysin is the most important among them. It is also leucocidal, cytotoxic, dermonecrotic, neurotoxic. It is also toxic to lysosomes, muscle tissues, renal cortex and the circulatory system. Next one is the beta hemolysin. It is responsible for the hot cold phenomenon. It means the hemolysis is initiated at 37 degrees Celsius and it only becomes evident after chilling. That is the reason why it is termed as hot cold phenomenon. The next one is gamma hemolysin. It is also responsible for hemolytic activity. And the delta hemolysin, which is having a detergent-like effect to the erythrocytes, leukocytes and the platelets. And the other one is the leukocidin. It is otherwise known as Panton-Valentine toxin, and it is also responsible for lethal effect to the WBCs. And the next toxin is enterotoxin. This toxin is responsible for the manifestation of staphylococcal food poisoning. There are almost 8 antigenic types of enterotoxins found. And this toxin is believed to act directly on the autonomic nervous system to cause the illness rather than on the gastrointestinal mucosa. This enterotoxin is a potent toxin, and even in micrograms it is capable of causing the illness. The toxin also exhibits properties like pyrogenic, that is fever inducing, mitogenic, that is inhibiting normal cell division, and it can be hypotensive and thrombocytopenic, and it is also having cytotoxic effect, that is cell toxicity. The next toxin present is the toxic shock syndrome toxin, or TSST. It is responsible for a fatal multisystem disease presenting with fever, vomiting, diarrhea, hypotension, erythematous rash. And the next one is the exfoliative or epidermolytic toxin. This toxin is responsible for the staphylococcal scalded skin syndrome. And this disease is having different manifestations, including the Ritter's disease in newborn and the necrolysis in older patients. And also there are milder forms in this milder forms of this disease. This is caused by this exfoliative toxin, like the pemphigus neonatum, bullous impetigo. These are the diseases that is being caused by these toxins. It was earlier mentioned that the staphylococcal aureus diseases have been grouped into 2, and they are infections and intoxications. Let's see the mechanism of pathogenesis in infections. In this, the cocci will gain access to the damaged skin, mucosal or the tissue site, and they will colonize there by adhering to the cells or extracellular matrix. They will invade the host defense mechanisms, and they will continue multiplying there, and at last they will cause the tissue damage. Common staphylococcal infections are the following. First one is the skin and soft tissue, that is, it includes folliculitis, furuncle, it's kind of a boil, abscess, wound infections, carbuncle, impetigo, parenchyma, cellulitis. These are all the names of the certain skin infections that is caused by Staphylococcus. Abscess are the pocket of pus that collects in tissues or organs or space inside the body. And these are the images of other skin infections like impetigo, parenchyma, cellulitis, wound infection. The musculoskeletal infections caused by Staphylococcus aureus include osteomyelitis, arthritis, bursitis, pyomyositis, and the respiratory infections include tonsillitis, pharyngitis, sinusitis, otitis, bronchopneumonia, lung abscess, emphysema, and rarely pneumonia. And in central nervous system, it causes abscess and meningitis and intracranial thrombophlebitis. And then the endovascular system, it causes bacteremia, that is bacterial in blood, septicemia, pyemia, endocarditis. Endocarditis refers to the infection of heart's inner lining, usually involving the heart walls. And urinary tract infections are very rare or uncommon, but sometimes they result in urinary tract infections also. Next one is the intoxications. The disease is caused by the bacterial exotoxins, which are produced either in the infected host or preformed in vitro. Mainly there are 3 types. food poisoning, toxic shock syndrome, Staphylococcus cable skin syndrome. In the beginning, we have already discussed about the toxins that is responsible for these diseases to initiate. Let's see what's happening in food poisoning. Enterotoxin is responsible for the manifestation of staphylococcal food poisoning, and there are almost 8 types of enterotoxin that is currently known, and it's named as A, B, C, 1, 2, 3, D, E, and H. It usually occurs when preformed toxin is ingested with contaminated food. The toxin acts directly on the autonomic nervous system to cause the illness rather than gut mucosa. The common food items responsible for these intoxications are milk and milk products, meat, fish, and ice cream. And the source of infection is the food handler, who will be a carrier. And the incubation period for the intoxication is 2 to 6 hours. And the clinical symptoms of the food poisoning include nausea, vomiting, and diarrhea. The illness is usually self-limited with recovery in a day or so. The next one is the staphylococcal toxic shock syndrome. It is caused by the toxic shock syndrome toxin, termed as TSST. It is a fatal multi-system disease presenting with fever, hypertension, myalgia, vomiting, diarrhea, mucosal hyperemia, and erythematous rash, which desquamates subsequently. Here, myalgia refers to the pain in muscles, and hyperemia refers to the increased amount of blood in the vessels of an organ or tissue in the body. 2 types of staphylococcal toxic shock syndromes are there. The first one is associated with menstruation, and here the organism Staphylococcus aureus occurs in the vagina of menstruating women. And the second one is the non-menstrual associated. Here the colonization of Staphylococcus aureus occur in other sites like surgical wound. The third kind of intoxication is the staphylococcal scaled skin syndrome, which is caused by the exfoliative toxin produced by Staphylococcus aureus. It is a skin disease in which outer layer of the epidermis gets separated from the underlying tissues. There are different types of scaled skin syndrome. In newborns, the severe forms are termed as Ritter's disease and the milder form is termed as pemphigus neonatum. And in older patients, the severe form is termed as toxic epidermal necrolysis and the milder form is termed as bullous impetigo. Now let's discuss about the laboratory diagnosis of the Staphylococcal aureus. The specimens to be collected depends upon the type of infection that is caused by Staphylococcus aureus. As Staphylococcal aureus affects various parts of the body like the skin, musculoskeletal, respiratory system, central nervous system, and the endovascular system, the specimens to be collected also differs. If it is in the case of a suppurative lesion, we have to collect the pus. If it's a respiratory infection, sputum has to be collected. If it is a bacteremia or septicemia, that is if the infection has spread to the blood, the specimen to be collected has to be blood. If it is an intoxicated occasion, like a case of food poisoning, we have to collect the fecal matter or the vomit or the remains of the suspected food. And in order to detect the carriers, we have to take the nasal swab. First method of examination is a direct microscopy. Direct microscopy with Gram-stain smear is useful in case of pus, where cocaine clusters are seen. But this is of no value for specimens like sputum, where mixed flora are normally present. And also the diagnosis may be readily made with cultures. The specimens are plated onto the blood agar and also to selective media like ludulums or salt milk agar can also be used. And then the culture characteristics is being observed. And from the culture, gram staining is also performed and the smears are examined from the culture plate and reveals gram-positive cocci arranged in grape-like clusters. And we can also do the various biochemical reactions like catalase test, coagulase test. In the case of coagulase test, both slide test and tube test can be performed. And also antibiotic sensitivity test is done as a gate to the treatment. Also bacteriophage typing can also be done for the epidemiological purposes. And other typing methods includes DNA fingerprinting, ribotyping, PCR based analysis, and serological test is not useful in the case of Staphylococcus aureus. Bacteriophage typing is also done for the epidemiological purposes. Other typing methods include DNA fingerprinting, ribotyping, and PCR based analysis. Serological test may sometimes be the help in the diagnosis of some infection, but generally it is not useful. Serological test refers to the test based on antigen-antibody reactions. Rapid coagulase test kits are available to detect cell-bound clumping factor protein A or a combination of both. Epidemiology refers to the branch of medicine which deals with the incidence, distribution, and possible control of diseases and other factors relating to health. Staphylococcus are primary parasites of human beings and animals. It colonizes the skin, skin glands, and mucous membrane. The most common source of infections are human patients and carriers, animals and inanimate objects. The cocci shed by patients and carriers contaminate fomites such as handkerchiefs, bed linen, blankets, etc. And also the staphylococcal disease may follow endogenous or exogenous infection. The modes of transmission may be by contact, direct or through fomites, by dust or by airborne droplets. Hospital infections by staphylococci deserve special attention because of their frequency and because they are caused by strains resistant to various antibiotics. Staphylococci are a common cause of post-operative wound infection and other hospital cross infections. In that, some of them are epidemic strains cause epidemics of hospital cross infections. Drug resistance is common in staphylococcal infections. Benzyl penicillin is the most effective antibiotic used if the strain is sensitive. Cloxacillin or methicillin is used against beta-lactamase producing strains. Because beta-lactamase producing strains can degrade the beta-lactam ring that is present in the penicillin. So in that case, cloxacillin or methicillin is being used. But also methicillin-resistant Staphylococcus aureus strains have also been emerging and they are termed as MRSA. In that case, vancomycin is used in the treatment of infections with MRSA strains. Measures for the control of staphylococcal infections in hospitals include isolation and treatment of MRSA patients, then isolation of patients with open staphylococcal lesions, detection of staphylococcal lesions among surgeons, nurses and other hospital staff and keeping them away from work till the lesions are healed, strict aseptic techniques in operation theatres, avoid indiscriminate usage of antibiotics, and the oldest, simplest but the most effective method of checking hospital cross-infection is hand washing, which is often neglected unfortunately. In the beginning of the session, we have also mentioned about the coagulase negative staphylococci, that is staphylococci other than the Staphylococcus aureus. It includes Staphylococcus epidermidis and Staphylococcus saprophyticus, and these also cause few human infections. Staphylococcus epidermidis is a common cause of stitch abscesses. It has a predilection for growth on implanted foreign bodies such as artificial valves, shunts, intravascular catheters, and prosthetic appliances, leading to bacteremia. In persons with structural abnormalities of urinary tract, it can cause cystitis. Endocarditis may be caused particularly in drug addicts. Staphylococcus saprophyticus cause urinary tract infections, and the infection is asymptomatic and may involve the upper urinary tract. Men are infected much less often. It is one of the few frequently isolated coagulase-negative Staphylococcus that is resistant to the antibiotic novobiocin. These are some of the distinguishing features of the major species of Staphylococcus. You can see that the coagulase is only positive for Staphylococcus aureus and sensitivity to novobiocin antibiotic. Both aureus and epidermidis are sensitive to novobiocin, but this saprophyticus is resistant to novobiocin. Acid from mannitol fermentation anaerobically. The test is positive for Staphylococcus aureus alone, and phosphatase production is also found in Staphylococcus aureus and epidermidis, but it is absent in the case of saprophyticus. In this you can see that the epidermidis is sensitive to the antibiotic novobiocin, whereas saprophyticus is resistant to the antibiotic novobiocin.